Medical rural colleges want to achieve high standards of care for patients right across the country. As clinicians, we feel that it is ethically wrong that the standard of care of a patient receives at the weekend is lower than the standard provided on a weekday. The Academy of Medical Rural Colleges previously published 3 standards to support providing more equal levels of care for hospital inpatients across the whole week.
So what sort of consultant should be seeing patients 7 days a week? One thing that this new report highlights is the need for us to consider the production of a different sort of consultant. Many patients will benefit from the attentions of a highly specialised consultant, depending on their illness. But increasingly we're seeing patients admitted to hospital who are elderly, have more than one thing wrong with them, have multiple comorbidity, as we say. And for these patients, we believe that a generalist, someone with the skills to manage all those conditions and bring in the specialist as required, is what's going to be necessary.
Hospital support services are also vital. There is a regular need for pharmacy, physiotherapy and specialist nurse review at weekends.
The other issue, of course, is patient safety. That if we are to transfer care out of hospital, there must be a safe place to transfer it to. And that means that those services in the community which can support the patient must also be available 7 days a week.
And of course, the patient's perspective is absolutely crucial on all of this.
I was admitted to hospital at about 4 o'clock on a Saturday afternoon after falling and breaking my hip. I saw the consultant orthopaedic surgeon at least twice before I went up to the ward at 6 o'clock, and I had my operation the following day, which was completely successful. It was incredibly reassuring to see somebody of that seniority because I hadn't been in hospital for 35 years and I was quite concerned.
So will the move to effective 7-day working imply some sort of reconfiguration of services? Well, a lot will depend on local circumstances, and I don't think one can generalise about this, but it's difficult to imagine that it would be possible to provide an effective 7-day service without some element of reconfiguration.
For 7-day care to really work, it will require some reconfiguration. As long as this is clinically led and patients and their families are involved, then it's the right thing to do.
This extra provision at weekends will cost the health service more, and we would like to see the government or the NHS or both do some economic modelling to understand as a society how much this is going to cost. Above all, we want to see better care for patients across weekends and bank holidays, and a health service that can truly be said to meet the demands of the 21st century.